I'm really great honor to be part of this prestigious gathering of the district leaders who are striving hard, who are making their efforts, who has tireless efforts, has formed the very cornerstone, the bedrock of the healthcare system of the Balochistan. Today's conference is not merely a workshop, it's not only a gathering, but it is a reaffirmation of the government's commitment led by Minister Bakht, Chief Minister Government of Balochistan, to create, to build a resilient, a transparent, a digitized and quality healthcare system which provides the masses quality healthcare system with dignity and efficiency. As we all know, even Scott and his team is like our family. He has been in Balochistan, in flood, in so many crises. He has worked in Balochistan. He has a vast experience of Balochistan. When we talk about Balochistan and we compare it with other provinces, so we are lagging behind in too many things, and of course in healthcare system as well. As today's conference is about the secondary and tertiary care hospital leaders, so my focus would be on tertiary care hospital, not on primary healthcare system, which is really the very cornerstone or the backbone of a healthcare system. So tomorrow we'll be having the DHIS and DMS conference or workshop. So we will discuss in detail about the primary healthcare and the challenges we are facing in primary healthcare. And of course, as I know today, our focus, it should be on the tertiary healthcare and our curative system, what the challenges we are facing. When we talk about the challenges of healthcare of Balochistan, so it is deeply rooted in our geography, and only 3% people of the entire country are living on 44% of this mass land. We are having a very small settlements which are having poor infrastructure. We have long distances. We have tough terrain which badly hampers providing health care to the people of Balochistan. We are having a mass land of 44% of the entire province, but we get only 9% of the total revenue generated from the Pakistan, from the whole country, from the NFC. So building infrastructure, revamping infrastructure, making an efficient healthcare system, making a quality education system is really a Himalayan task. Even though we are working hard to work in the limited resources, to improve the healthcare system. In today's gathering, we are having our leaders from Awaran to Shirani, from Zhug to Bela, and it is really happening for the very first time in the healthcare history of Balochistan that this workshop is of different nature from the previous workshops in which you have participated. Today, we are going to talk how to make our hospitals, whether they are tertiary hospital, DHIS hospital, more efficient, how to work on how to ensure the presence of the staff over there, how to make an efficient supply chain management of medicine for the entire health facilities, which has remained a challenging task from decades. So, Government of Balochistan, as Secretary Health said, 8 months before, when we were given this task, and it is for the first time that the entire leadership, whether CM of Balochistan, the opposition, all the members of the parliaments, they all are agree that this is the need of time to revamp our healthcare system. And we have been tasked, our team has been tasked to work freely to make legislation, to make a roadmap, better, efficient, vigilant healthcare system. And since then, we have been working, and we have worked a lot. We had many consultative meetings with our partners, with the provincial governments. We took all these best practices which are happening in Punjab, Sindh and Kapi, and then we made a plan. And today is the time, and today is the day, and this workshop, we will start implementing these plans. And the roadmap which we are talking about is for the first time is going to be locked, and it will be a plan of 10 years. Whether I am the minister or someone else is the minister, he has to follow the same roadmap to improve the indicators, the gloomy, the discouraging indicators of the healthcare system. It's really embarrassing, discouraging when we discuss our indicators. If we talk about the MNCH programs, even now 40% of deliveries are done at home without any medical help. For the 37% immunization coverage, so with this 37% immunization coverage, I'm not sure that we will be able to eliminate polio from this region. With the 47%, about half percent of our population is stunted, and we are going to have an incomplete, cognitively, physically population, which can be a liability in future of this region. And now it is the responsibility of every citizen, particularly every healthcare provider, and all those, the policy makers and the health department, to work on these indicators sincerely and improve these indicators. For improving these indicators, this is not just we have been listening, we have been talking about these all. For the first time, we have aligned our budget. We have put our resources to improve our MNC services. We have allocated 1 billion rupees for the revamping of 1,000 delivery rooms. Where all equipments will be provided with IPC protocols. For the improvements of other things, like we realize that Balochistan is far-flung and we had no system of monitoring. So when you have no monitoring, so you won't be able to know about your healthcare providers, whether they are present in their vicinities, where they are on work, where they are in outreach program, they are working or not working. For the first time, we have fixed, we are going to start by next week our attendance of all healthcare providers by AI cameras, artificial intelligence cameras. Their reporting time and their exact time will be noted, and all these healthcare providers will be given salaries as per their report of the AI cameras. And same, we are going to digitalize the whole healthcare system from BHU to tertiary care hospital. In hospital, we will be having MR numbers. Our pharmacy will be digitalized, and we would be able to track every medicine, every tablet that is given to the end user. Gone are the days when we were unable to track our medicine. And we always used to cry that we don't have medicine. Now the registers which were used for making these records are no more in hospitals. Now the whole record will be digitized. We will be having real-time data of every patient. And even we have decided to install cameras in hospitals, particularly in emergencies, in gynae departments, in doctor rooms, to know or to have a real-time vigilance on our healthcare facilities, where there are always complaints that in emergency there is no doctor, especially at night. So this is the investment the government of Balochistan is going to do, and I hope with the digitization, with the integration of the programs, like too many programs are working on mother and child, NCH, MNCH, nutrition program, and they are working separately. So now we are planning to integrate these all programs in health facilities, and inshallah they will be working efficiently, and we will be regulating these all programs. Apart from this, as you know that we had these two issues in our healthcare system. One was of governance and the second was of course of HR. In governance, as I told you, we have established an independent monitoring unit which will directly report to the Secretary and Minister on daily basis. He has to visit the headquarter hospital, the RHCs and the DHIS, and he will be having a tablet, electronic gadget, and these all data from these hospitals will be synchronized and will be getting sitting here in Quetta. And those who are not working, I'm not sure, then they won't be part of the healthcare system or they won't be part of our team. For governance, this digitization is the ultimate solution, where your attendance, your supply chain, your patients, all records through a mass system will be kept, and wherever he goes in Balochistan, all data will be available over there. And in HR, we do know that there are two serious issues. When we are lacking in HR, whether they are doctors, they are nurses, they are paramedical staff, and those 20,000 or 24,000 workers we are having, they are not fully trained. Their capacity is not there to provide us a quality service. What we have decided, we have a program in our PSTB of 500 million, where we will be capacity building, we will be joining the capacity building of this HR in trenches, particularly the technical HR, the radiology assistant, anesthesia assistant, and so many technical HR which is needed in the hospitals, in THQ or DHQ hospitals. So their capacity building will be done here in Balochistan, and their exposure visits will be done in the entire country. And this is a program which will be funded by, of course, our own provincial PSP. And for the recruitment of the missing HR, so far we have recruited more than 800 doctors on contract, and we are planning to recruit more than 1,300 doctors. And I hope in the third stage we would not be able to have a doctor in Balochistan who is not on job. That is not a big success that we will provide job or we will appoint the doctors. Sending them into the peripheries, making them available over there is of course a tough ask, but we have made a plan. For the first time, we have promoted 1,200 doctors, and after their promotion, these all doctors will go to their hometown, those towns from where they belong, and they are going to work for 1 year at least. By doing so, we would be able to open all our health facilities to full throttle, where all services will be available and our team will be monitored. And the very important thing that healthcare department has done, we have made an app for all the doctors. They are having their Android phone. When they will reach their facility, they will share their live location, and the time he spent in this vicinity. So this all location, 3 hours, 4 hours, 5 hours, that will be recorded on our system. And we will be able to know that in Washoe, in Lorelei, in Avaran, our 6 doctors, our nurses, our paramedical staff, they are in hospital. Right now we have no system. I can't say a doctor is available in the Pashin or a doctor is available in the Musakil or not. By applying this app, I will be able to know that who is where. This is the technology which the other provinces has adopted successfully, and we are going to adopt, and inshallah this will bring a big change. As we are having our leaders, so I would like to speak in Urdu as well. These few words were only for Scott. I'll be having a detailed meeting with you about our plans and what we are going to do and what support we need from the UNICEF and other organizations. But the focus of today's workshop is these leaders, these front line workers, healthcare providers, who are ready to bring a change in the tertiary and secondary care healthcare system of the